Well, good evening, everyone, and welcome to the June 2nd, 2025 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Andrew Chaluka.
Andrew Chaluka here.
Dan Finn.
Dan Finn here.
Thank you. Staff and anticipated speakers on the agenda, when I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Amelia Houghton.
Amelia Houghton here.
Molly Scannell.
Molly Scannell here.
Devon Thornton.
Devon Thornton here.
Thank you. I'd like to open the meeting. May I have a motion to open the meeting?
Motion to open the meeting.
There a
Sorry,
second?
Andrew Chaluka, motion to open the meeting.
All right. I know Dan's meeting is a little slow. Dan, you might have to turn your camera off because that might make your voice more apt to work. Dan, can you hear us? You might have to dial in.
Okay, there we go. Sorry.
You're gonna second that motion?
I'd like to second that motion to open the meeting.
Wonderful. Roll call.
Dan Finn, aye.
Andrew Chaluka, aye.
Jen Maynard, aye. Thank you. All right. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency. Governor Healy has further extended this act until June 30th, 2027. Of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There's no public hearing scheduled for this evening's meeting. If the public has a question or comment on the agenda items, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first meeting on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers of the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes on motions made during this meeting will be conducted by roll call vote. Whew. Okay. Welcome, everyone. We're going to get right into it. We have a few items here tonight, but I'm going to turn it over to the Alliance for a variety of updates. Molly?
So our flu and COVID numbers are expectedly a lot less due to the season. For the month of May, only one case of influenza was reported from the 11 that were reported in April, which is still pretty low. For COVID, only 2 were reported in May, down from the 6 that were reported in April. There is a new COVID strain, NB181. It's an Omicron variant, and this new strain is currently surging in China and has been detected by the U.S. Center for Disease Control and Prevention's airport screening program in California, Washington, Virginia, and the New York City area. According to Robert F. Kennedy Jr., the COVID vaccine will no longer be recommended for healthy children and pregnant women, citing that over 95% of the U.S. has population immunity at this time. The FDA will only recommend COVID-19 vaccines for adults 65 years and older, and those 6 months to 64 years old with at least one risk factor. I do have a link for those vaccine-specific recommendations. I sent them previously to Nancy. If you're interested, I can send them as well. For a measles activity update, according to the CDC, as of May 29th, 2025, a total of 1,088 confirmed measles cases were reported by 33 jurisdictions encompassing 14 outbreaks, and none of these include Massachusetts. There have been 3 confirmed deaths from measles. 2 have been children, 1 has been an adult. Travel health precautions for measles. Cases are rising in many countries around the world. All international travelers should be fully vaccinated against measles with the measles, mumps, rubella, the MMR vaccine, according to CDC's measles vaccination recommendations for international travel. So they don't really suggest an adult booster at this time. If you're vaccinated, it should be okay. For bird flu activity, human cases, at least 70 people in the US have been infected, mostly farm workers exposed to infected dairy cows, and 1 person so far has died from bird flu. For animal spread, the virus has affected over 1,000 dairy cattle herds across 17 states. It has also been detected in wild birds, poultry, and even mammals, such as cats and seals. For vaccine development, the US government recently canceled over $700 million in funding for Moderna's bird flu vaccine, citing concerns over scientific standards and safety. For surveillance and prevention, the CDC is closely monitoring the situation and has confirmed that no sustained human-to-human transmission has occurred. However, experts warn that the virus could mutate. Preventing infection also comes down to maintaining good hygiene, keeping vaccinations up to date, and being aware of your surroundings. If a dead bird is on someone's personal property, they are responsible for disposing of it. And they should wear protective equipment such as masks and gloves to handle it. If there is a dead bird in the public way, then animal control is responsible for picking it up. To report 5 or more dead birds in one location, there's an online reporting site, which I have that link. I've previously sent it before, but if anyone's interested, let me know. Livestock and poultry. Since wild migratory birds are natural carriers for bird flu, preventing wild birds from mixing with or having contact with domestic flocks is essential to disease control and prevention. There are current outbreaks, for travel health precautions. There are current outbreaks of chikungunya, which is a virus spread by mosquitoes in the area of the Indian Ocean. It is vaccine preventable, and vaccination is suggested for travelers to areas of high rates. Some international destinations have currently circulating polio virus, and adults may receive 1 lifetime booster dose of polio vaccine if traveling to areas where rates are high. And then for other global outbreaks and travel notices, I have a link for the CDC travel health notices. Mosquito season is approaching, typically from June to the first hard killing frost, which is usually October. the Massachusetts Department of Public Health's DPH Arbovirus Surveillance and Response Plan provides surveillance and phased response guidance for arthropod-borne viruses, arbovirus, affecting Massachusetts residents, Eastern equine encephalitis virus, which is triple E, and West Nile virus in particular. Local boards of health are asked to provide routine and emergency contact information for primary and secondary arbovirus contacts during this season. These individuals, referred to as arbovirus coordinators, are DPH's first and primary point of contact with regard to arbovirus season information. Communication to local boards of health occurs through multiple mechanisms, routine communications and initial communication about any findings primarily occur through the HHAN to the identified arbovirus coordinators. Important summary communications, such as weekly reports. These are done by Amelia. Amelia does these weekly reports usually. Are also sent out through the DPH Office of Local and Regional Health listserv. Urgent communications impacting multiple municipalities may be sent through the HHAN to arbovirus coordinators, other local boards of health members, and the OLRH listserv. Spray season has begun. The Central Mass Mosquito Control Project, the CMMCP, is a regional program in Massachusetts focused on mosquito control and public health. It provides services like larval control, adult mosquito spraying, ditch maintenance, and surveillance to reduce mosquito populations and prevent the spread of diseases. CMMCP also offers public education on mosquito prevention and allows residents to request mosquito spraying or to opt out of pesticide applications. The program operates through the summer, applying larval control products in catch basins and monitoring mosquito activity. Since mosquitoes thrive in warm, humid conditions, prevention methods like using insect repellent, eliminating standing water, and wearing protective clothing are essential to reducing exposure. So the 2025 spray season is scheduled to begin today, June 2nd, weather permitting. So requests to spray can be accepted at the Central Mass Mosquito Control Project, and I have that link as well from Amelia. So let me know if you need any of those links.
Great, thank you.
And can I just add one thing? I noticed you had on your agenda RSV update, and that really hasn't changed much from the World Health Organization. They recommend that the maternal vaccine be given to pregnant women during the 3rd trimester of pregnancy from week 28 onwards. And this is what optimizes adequate transfer of antibodies to the baby. And it can be given during any routine antenatal visit as well, postpartum, in the 3rd trimester or any medical consultations thereon. So that was just the World Health Organization recommendation.
Great.
So that's it.
Thank you. Any questions, members, for Molly or Amelia?
No, thank you, Molly and Amelia.
Yep, thanks.
Devon?
Hello, everyone. I'm Devon Thornton, Environmental Health Inspector for the town of Grafton. Since our last meeting, there have been 14 comprehensive food inspections. Any violations observed were addressed or corrected on the spot. We also received 1 food establishment complaint. That complaint has been reoccurring. And it has to do with a dumpster at the rear of the establishment during the weekend. Employees don't close the top of the dumpster, and the resident that lives right behind the restaurant doesn't like it because sometimes animals are able to get into it and items are usually left outside of the dumpster. So his concern is pest. It could draw pest. I've reached out to the establishment and notified the managers about the issue as I did the first time, but I think the communication wasn't as stern as it should have been. So there's actually going to be some signs put up in the restaurant that whenever anyone throws anything away in the dumpster in the back, to make sure that they close the top on the dumpsters during all business hours, and make sure they close at the closing of business hours as well. We've had 2 housing complaints, and it was actually outside nuisances, trash, and just too many items on the property. We sent out one order to correct to one of the properties, and I'm working with the building commissioner to address one of the other properties. There's also one pool inspection done, and that is it. Any questions?
Questions for Devon? Dan, go ahead.
Yeah, Devon, on that dumpster issue at the restaurant, will you be able to have time to swing by there before the end of the month? Just to spot check it as opposed to waiting for another complaint?
Oh, definitely. I'll be in Grafton tomorrow. I'll go check tomorrow. I'll actually try to swing by every day I'm in Grafton to make sure they stay on top of it.
Okay, great, thanks.
The problem is they're not closing it on the weekend. That's the problem.
Yeah.
See.
That happens, of course.
But I'll stop by frequently to just give a gentle reminder.
Yeah, but it sounds like it might need more than that if they don't comply, you know?
Yeah.
Okay, thanks.
You're welcome.
Thank you, Devon.
You're welcome.
Great, thank you. Any updates from the group on the opioid settlement funds?
Yeah, I guess I can.
Go ahead, Dan. I know you're in and out freezing.
Mention that to Dan.
Dan, you might want to turn your camera off just because sometimes
Everybody saw because can you hear me? Can you hear
we
me?
could.
Okay.
There we go. That now we could probably hear you. It was
Okay,
very tough.
Let's give it a try. Can you hear
All
me?
right.
Yeah.
Yes.
So I think most people saw last Thursday, Evan and Mary presented, they had a signed agreement with Gap Recovery and presented a mock check for a photo. And we now have a 1-year agreement with this local organization to provide recovery coaching. And they're all certified for that and have experience, as well as harm reduction support, community outreach, and assistance with residential placement if that's required. So we're kind of happy to get that off the ground. We have another meeting coming up on the 17th, and we're going to probably address more Narcan training with folks at that time.
Great. Thank you, Dan. Great news. Dan, do you want to take item number 4 and 5, the FEP rep and Board of Health members?
Yeah, I was going to make a suggestion on the FEP rep that we wait a month or 2 and see how things sort of settle in with the Board of Health. Andrew's brand new and he's going to be great. And then Andrew, I apologize. I don't know that I have gotten to you yet to mention that I've decided not to seek reappointment myself. So there may be another candidate coming on board. And not just that, but I think FEP itself is probably in some reorganization in that Jamie Terry is leaving after June 30th, and she's sort of been the go-to person in terms of reporting. And Amelia won't be able to take on. I was actually just the sort of back rep, but for now, Reserve Corps, and she said she would be able to attend meetings. She gets all the information, and I think Kathy from CERT also is in touch. Nancy may have to pick up the quarterly drill if one comes up over the next month or two, but there's so many changes. I'd feel comfortable waiting another month or two before you folks put somebody in that position, you know. So I think we should, if it's everybody agrees, or that we should, maybe if that's the consensus, we should just table it for another month or two.
Right, so Dan, you would stay as you are as the rep for now there.
Right.
While you're rolling off at the end of June.
Right.
And then Marianne DeVries would also continue she's able to join in on some of those.
Yeah, she'll be able to attend the meetings either remotely or in person. So we have some representation for the town for sure. And a lot of it basically, so Andrew, you know, it also involves supplies for emergencies and things like that, which Amelia was on top of. And I can, when somebody does come on board, I'm going to be around both with the opioid committee, recovery partnership, and then also with the Medical Reserve Corps to give advice or help anybody that goes into that role eventually. But I think we're covered for now until things shake out, so to speak.
Right. Nancy, any concerns with us kind of keeping that for now until things start to settle? Go ahead, Nancy.
We have some stop the bleed kits coming in for the emergency dispensing sites. And if they have any questions and there's no one there to represent Grafton, I don't know what would happen. So I don't know if you want to appoint Marianne, just so that we have somebody.
Dan, do you usually attend those or?
Yeah, either in person or remotely. There's one this Thursday, and I'll be home in time to attend that one. And in the meantime, after that, I'll check with Marianne and see if she can make the next meeting, if that's okay with you folks.
So Nancy, I think Dan's saying he could stay on as a representative from Grafton, even though he won't be on the board after June. But we'll talk to Marianne about helping out until we sort of settle who we would like to have appointed to that to assist. So June will be covered, and then he'll check. Is it monthly, Dan, that they're meeting for Feb?
No, it's just quarterly, actually.
Okay.
There is a monthly meeting though,
Well, okay, there's a Zoom,
the
a Zoom
first
meeting. But
Thursday usually.
yeah. So anyway, I'll attend this Thursday, and Amelia, you might be on too as well.
I will be.
Yeah.
The other thing I would say is a discussion will need to be had about an arborvirus coordinator. Because once the reports start, I'll keep it going, but I can only do it till the end of June. And then someone else will have to kick in either for the new alliance or one per town. I don't know how that's going to work.
I think that's kind of where Dan's going with, just us kind of pausing until maybe July when we kind of recommend who to appoint. Once we
Right.
figure out all those pieces as to who might be available to us to assist in some of those.
Yeah, that's right. I just would hate to drop into somebody's lap and we don't really know who to report to or any of that. And as it turns out, I thought this was going to be my last official meeting, but it looks like we're going to have another one in the middle of the month that Evan's trying to put together. And I think we can iron some of that stuff out at that meeting,
Okay. All right, so you'll attend on Thursday. We can check in with Mary Ann and we'll figure out July moving forward.
Yep.
And we need an arborvirus coordinator. Okay. All right, that's what we'll do for there. Well, and while we're on the topic, so it looks like this will likely be your last official Board of Health meeting with us. So on behalf of everyone, I'd really like to thank you for all your years of service to the board and your continued involvement. As you said, you're going to be on some of our subcommittees still as like an advisor. I know certainly you've taught a lot to a lot of us newbies and been very welcoming to get us engaged. So thank you for all you've done.
Yeah, you're quite welcome, and it's been a pleasure working with everybody. And I think we've all gotten some friendships out of it, as well as professional service. So
Absolutely. You will be much missed, Dan, but we know where to find you. Don't worry.
right.
Great. All right. So quick update on the ambulance subcommittee. It's kind of the ambulance, kind of the emergency kit subcommittee. We met last week. We're going to finalize sort of what the numbers look like for standardizing access to AEDs in town in really specific areas like the schools, the municipal center, police, fire, but present that information to Evan for him to be able to sort of digest what that could look like and what we have current state today. It's kind of a lot to digest, so we'll try and distill some of that. Nancy, I'll probably work with you to put together some sort of a letter to some of those stakeholders that we've been engaging to let them know why we're doing this and that we're, going to try and do something more coordinated through the town. And then last meeting, we reviewed the data that Todd had for us on essentially ambulance trips, how long it takes for folks to get access to an ambulance and emergency services when they need them. Looking at the data of how many times people actually get transported to the hospital or when they decline after evaluation. And our numbers look pretty good in Grafton, but we can always do a little bit more to make sure that we're freeing up access and also that residents have what they need and that maybe that's not necessarily the first phone call that they need to make. So we'll have some follow up with some other stakeholder groups. We're going to try and convene some learning sessions and find out what the needs are, maybe develop some kits. Molly, we might reach out to you as well with some of your insights since you've been out and about in some of those communities that may benefit from some additional resources. And I know you're doing a lot of that now, so we'll want to download some of that. But sounds like, some connections with people in the community that are, doing like senior housing, the Council on Aging, and really just making sure that we're identifying if people have unmet needs. Maybe we can help connect them with some of those and reduce some of those calls if necessary and appropriate. Andrew, anything to add to that? Great.
Nothing to add.
Thank you. All right, so Nancy, I'll follow up with you. And Devon, actually, I'll probably loop you in on some of those too, because you might have some of the people that we might want to connect with on your list of people that you already connect with as well. So great. All right, and then so we have a couple of updates on the Tufts IBC. We have two members, the Alyssa Arade, ex officio non-voting member, and Jennifer Nakajoba, alternate ex officio non-voting member, whose terms are up and they are not seeking reappointment for those. And so Tufts is looking for a replacement, but Dr. Bill Muller of our very own group here has said that he would be willing to serve as ex officio non-voting member. We cannot appoint him, but we can certainly make a recommendation that the select board nominate him for that role. So with that, would anybody like to make a motion to nominate Dr. Muller as ex officio non-voting member to the Tufts IBC?
I move.
Yeah.
Sorry,
Go ahead. Andy.
No, go ahead, Dan.
No, you. I can't remember all that.
Andrew Chalupka, I move that we recommend the nomination of Dr. Bill Muller as the ex officio non-voting member of the Tufts IBC
To the select board.
to the select board.
This is Dan Finn. I'll second that motion.
Great. Roll call.
Andrew Chalupka, aye.
Dan Finn, aye.
Jen Maynard, aye. I know that's a little bit of a mouthful, all of those. And then we actually have the Tufts community representatives term is also up. That is David Degwa. And he is interested in being reappointed to that role. So would anybody like to make a motion that we recommend to the select board that they reappoint David to as the community representative to the Tufts IBC?
This is Dan Finn. I'd like to make a motion to recommend to the board or to the select board, David Noinga as a re-upping member of the IBC board. Tufts.
And this is Andrew Chalupka, and I second that motion.
Roll call.
Dan Finn, aye.
Andrew Chalupka, aye.
Jen Maynard, aye. Great. I think, Nancy, remind me, did we get minutes for the 7th and the 5th? I
Yep.
don't remember if we did
So
yet.
April 7th, yep.
We did?
You don't
It was probably a while ago and I just forgot about it. Would anybody like to make any recommendations or discussion on the April 7th, 2025 meeting minutes?
No, so I would like, this is Dan Finn, I'd like to make a motion to accept the minutes of the April 7th, 2025 minutes of the Board of Health.
This is Andrew Chalupka, I second that.
Okay, roll call.
Dan Finn, aye.
Andrew Chalupka, aye.
Jen Maynard, aye. Okay, so we had April 7th, but not May 5th, right? Okay. All right, I have no old or new business or mail correspondence. For upcoming meetings, we do have not a full Board of Health meeting, but just a public hearing scheduled for June 16th. Nancy, do we know, is that going to be fully virtual?
That will be both.
It will be both.
I do have quorum for conference room.
Okay, great. So that will be both at the municipal center and available online. Members of the public are certainly recommended if you want to submit questions or testimony beforehand to do so, or attend the meeting. And then we have our standing meetings scheduled for July 14th, August 11th, September 8th, October 6th, November 10th, and December 8th. As we get closer to those meetings, we will indicate if they are hybrid or virtual or in person. I have nothing else on our agenda for this evening. Are there any other items to bring forth? Or any motions to be made?
This is Dan Finn. I'd like a motion to adjourn this particular meeting and wish everybody a nice evening and a happy summer.
This is Andrew Chalupka, I second.
Roll call.
Dan Finn, aye.
Andrew Chalupka, aye.
Jen Maynard, aye. Oh, your final adjournment motion, Dan.
No, I know.